And welcome to the Dr. Tech Show, where myself, Pauline, Roche, and Sweyn Hunter, and occasional guests guide you to the world of online communications in a show which was the brainchild of the late great internet evangelist John Popham. And in usual fashion, we want to know what the weather was like. Sweyn, how are you? Where are you? And what was the weather like where you are?
I'm in Orkney as usual, and the weather is beautiful today.
Good to hear. And our special guest today is Claudia Pagliari. Claudia, can you hear us?
Yes, I can hear you.
Welcome to the show. Please tell us where you're coming from and how the weather's like there.
Thank you. I'm in Edinburgh in Scotland, and the weather today here is fair but a bit breezy. But we're still holding out the last piece of summertime.
Excellent. It is still August, and here in Birmingham, it is beautiful in Northfield, where I've been working on Northfield Beach as part of my new role with Northfield Community Partnership. We do an urban beach over 4 days in August. We had another one earlier in July in Kings Norton, but this one is in Northfield, and it's going really well. And the weather has been beautiful, got better and better during the day. So it's busy, and it's great to see everybody out enjoying themselves. So before we get to speak to Claudia, we will cover a few things that we usually cover, as our listeners usually expect. So for August, we discovered when we were doing an editorial meeting last week that it's actually National Immunisation Awareness Month. It is
in the United States.
Yes, it's the US month, but I think it pertains to all of us now. This is sponsored by the National Public Health Information Coalition in the US and observed in August annually across the USA. And the campaign for this aims to raise awareness of the importance of vaccinating people of all ages against a number of serious and sometimes deadly diseases. And the Awareness Month also celebrates the successes of the different immunizations that have been created in the 20th century and beyond. And the campaign has 4 key messages. They are that vaccines protect against serious diseases, that diseases still exist and outbreaks do occur, that vaccines are recommended throughout our lives, and that vaccines are very safe. So good messages for us all to be hearing right now. Obviously, as we know, there remain debates about the safety of vaccinations available, but governments across the world, acting upon the advice of leading scientists and medical professionals, overwhelmingly support immunization schemes. Obviously, there are anti-immunization supporters and some other factors, and this has led to a decrease in the number of people becoming vaccinated. So there's little surprise the number of people affected by diseases that in some cases had been eliminated from some countries is on the rise again. So a caution to us there. And another event that we picked up celebrating around this time of the year, on the 28th of August in 1963, was when Martin Luther King delivered his I Have a Dream speech, addressing the March on Washington for Jobs and Freedom Civil Rights March at Lincoln Memorial in Washington, D.C. A couple of events that might be of interest to our listeners. On the 26th of August, Thursday this week, is one called Computing for the Soul, which is a one-off event for the Sheffield tech community to meet in person and share the experiences that helped them through the last 18 months. And they're looking for talks in any technology or practice that held people's interest, improved their lives, or brought their community together. This is about people's own experience in looking at technology through an optimistic lens. And the format for this event is going to be on conference style, so the attendees will decide the agenda. So they're asking for 10 to 20-minute talks, slides optional, and they'll post them on the board at the beginning of the event. They say people are also welcome to just attend and listen. So I imagine that people from outside Sheffield might want to just sign up and just kind of listen along. It's one I think I'll be signing up for, because I really get on well with the Sheffield tech community, and I'd like to hear what they've been up to. And in Preston,
that sounds like a good one.
Yeah,
and it's lovely to see an on conference, and it's at 6:30 in the evening on Thursday 26th. So I might try and join in as well.
Good timing, and a nice title, Computing for the Soul. That's very appealing.
Yes.
And on Saturday, 28th of August, is Makefest Preston. And this is an event where people can meet makers, from children to adult computer scientists, explore the potential of digital making, discover pathways into programming and games, and learn about affordable computers and building your own hardware, which again, I think might appeal to some of our listeners. Don't know if anybody's actually building their own hardware, but we do talk about Raspberry Pis from time to time, and affordable computers certainly. And this is their first showcase event where Preston's community of digital makers will demonstrate their projects, passion and talent, and they aim to inspire and engage others to learn more about affordable hobbies, exciting projects, as well as opportunities for careers in STEM and digital making. So again, one of those ones where you think, I might learn something there or add something to it. So whichever floats your boat. The final event that I picked up actually only last night, and it is on the 29th of September, but I thought it was useful to mention it now, and we'll probably mention it again near the time, because of our guest who has digital health as one of her interests. It's called The Doctor Will Zoom You Now, Overcoming Digital Barriers to Healthcare. And tickets for this are available on Eventbrite, and it's the Leeds Digital Festival 2021 event, and that's running from the 20th of September to the 1st of October. And this particular event will showcase best practice in digital inclusion and how that can lead to better health and outcomes. So the question they're asking is, how did lockdown and the rapid move to remote digital healthcare impact on the most vulnerable people in our society? And how can a project named SHIPS help? Well, sign up, they're saying, for this fascinating webinar, which showcases best practice in digital inclusion and how that can lead to better health and well-being outcomes for socially excluded groups, including people experiencing homelessness, refugee and asylum seekers, and sex workers. So again, I think that's one that we and some of our listeners will find of interest. I think, I've set up this new community digital skills network in Birmingham. Well, I think some of my members there as well will be interested in that.
Just to say that SHIPS stands for Smart Health Inclusion Peer Advocates. I'm not sure if that helps, but that's what it stands for.
Yeah, great to have a name. I'm looking for a name for my project. Actually, digital literacy project it's a bit dull. So, and I'm offering a prize.
Suggestions on a postcard to the drtech@gmail.com, I think.
Dr. Tech Show, I think.
Dr. Tech Show. Always add the show.
Yeah. Other Dr. Techs are available. So we want to extend a very warm Dr. Tech Show welcome to our special guest, Claudia Pagliari, senior researcher and educator based in the Usher Institute. And Claudia is active across the Centre for Population Health Sciences, the Centre for Medical Informatics, the Edinburgh Global Health Academy, and the Institute for Science, Technology and Innovation. And it was last week, I think, only we saw this tweet by Claudia, which said that real-world messages about digital inclusion are arriving thick and fast today. Paper passport holders treated as second-class citizens. A taxi driver resenting being forced to buy a computer printer during COVID he'll never use again, according to the quote. Elders facing baffling WhatsApp T&C, terms and conditions. So we invited her to join us on the Dr. Tech Show. Claudia has a whole range of other experience and expertise. She directs the interdisciplinary research group in e-health. And this is while mainly focused on digital health, her research crosses topics, methods, and theories from diverse areas, including health technology assessment, science and technology studies, biomedical ethics, management science, data science, and policy studies. And a recent study, her recent empirical studies and expert reviews have looked at mobile apps for contact tracing, participatory disease surveillance and medication advice, empathic robots for mental health support, the use of digital innovations at the end of life, big data infrastructures. I could go on. There's a huge swathe of experience that Claudia brings, which we're looking forward to hearing more about. So Claudia, you're very welcome.
Except I believe Claudia has fallen off the call.
Oh dear.
So our line, as they say on the radio, we're having problems with our line. But I think we can probably go back to her in just a moment. So
okay. I can read out some more of her bio.
Here she comes.
Oh, here she comes. Okay. I don't. Did she hear the introduction, Claudia?
Part of it, yes.
Sorry about the technical gremlins.
Short circuit with my printer made a funny noise and had it seemed to shut down Zoom. Oh, right. I don't know. Straight. But yes, thank you very, very much. Yeah. Would you like me to add to that in any way?
Yes, please. If you can, what are the most things that you enjoy most about all the things that you do at the moment?
I enjoy its variety, obviously, and there's so much on the other things. I'm not sure if you mentioned that I also was involved in setting up the NHS Digital Academy and lead a course in that in citizen-centered digital health. Which considers aspects of so it's quite relevant to this documentary, and I also chair and I'm an advisor to the Scottish Government, and I chair a national expert group in digital ethics, and digital inclusion is one of the topics that we are studying across the board, not just in healthcare, but clearly it is relevant in this context. that's a couple of things. I'm also an advisor to WHO, World Health Organization, on digital health, but also in the pandemic, I've been looking mainly with them at the problem of misinformation and actually what they call the infodemic, which means it's not just misinformation. Some of it's misinformation, some of it's disinformation. In other words, it's deliberately designed to confuse you. And some of it's just too much information and not knowing how to make sense of it, which is a lot to do with the inequalities question as well, because we all differ in our digital literacy and our health literacy. And even some of us who can be extremely, switched on and are very scientific and are reading things with a very, objective eye, may be exposed to things that are not necessarily factual, even though they may appear to be. So that's been pretty interesting for me.
Absolutely, that's that's all relevant to our listeners and us as well, because we, obviously we spend a lot of time in the digital world, and we love picking up new things. We're like magpies, I think, both of us, Sweyn and I. We're like, we like picking up new things and sharing it with other people that we come across in our networks. So, Claudia, reeling back a little bit, how did you start off in kind of this field? If you want to go back to your kind of early kind of university days, if you like, what's your background in this world?
Yes, sure. I studied psychology at university, and then I did a PhD in psychology after that, and that was interested at the university. It was interested in intelligence and educational psychology and measuring aspects of people. Which I moved away from because it had some ethical issues connected with it, that field at the time. So that for me has been very interesting, because I'm now kind of paying more attention to that, because those same debates and issues are resurfacing in today's environment. And in a similar way, all of the theories and so on around intelligence are being applied in the context of artificial intelligence. So a lot of that is full circle. So that was pretty interesting. I was interested in social psychology, many aspects of psychology there. But then I moved out. I started teaching psychology, and as part of that, I taught things like human-computer interaction, which has to do with behavior and so on. And social psychology is to do with how we respond because of our social circumstances, again, relevant to digital health. And also aspects of cognitive psychology, how we process information. And again, that's proven useful going forward. So after that, I moved into I was a lecturer for a few years in psychology, and then I moved back into research because I wanted to just pick up my research again. And I took a fellowship at Aberdeen University, focused on, it was in an area called health technology assessment or health services research. And in that, I started off studying behavioral factors in the design and actual outcomes of so-called evidence-based clinical practice guidelines, which are a form of technology. Like, we classify lots of things as technology in health technology research. It might be a new policy, it might be a new way of delivering a service. This was a new type of technology that, strangely enough, in the past, it was just based on kind of opinion and papers that were reviewed in a quite selective way. And we moved into the world of evidence-based medicine, where actually gathering information from research was a much more structured and systematic and unbiased thing to do. And then you based your decisions about public spending on prescribing, for example, and indeed about what's an appropriate thing to prescribe or an appropriate treatment to offer people with particular conditions based on what the science is telling you. So these groups were analysing this evidence, and they were trying to make sense of it using library searches and their own expert opinion. And they were multidisciplinary groups. And so I was brought in to study them, and I looked at quite, the interesting things to do with social dynamics within these groups. For example, the power structure within the group, the different disciplinary mix within the group. And all of these things were having an influence on which evidence was coming forward into the guidelines. In other words, they weren't particularly they weren't purely evidence-based. They were also opinion-based and
The
status-based.
context in which the evidence was being both sifted through and also presented, which was social and psychological.
Absolutely. And some people, even at the time, were calling it eminence-based medicine.
Eminence.
Interesting.
Which was coming through.
That's clearly been one of the things that's been just under the surface about the advice that the UK and other governments have had about the pandemic right from the very beginning.
Bingo, exactly. All of this is very much relevant at a kind of macro level to policy decisions, but also behavior within government and between governments. So this has actually led to change in the guidelines. Absolutely, you're picking up a snowball, your snowball is rolling, and you're interdisciplinary and you're picking up these things. And I became a kind of expert in kind of public health research paradigms and the language of public health, and it was in a department of public health, and I was teaching aspects of this. So you're picking up that thing. And then it began when I was working in that environment. I started picking up on projects that were emerging on telemedicine, which were happening on oil rigs and in remote locations in the Highlands. And one of the
Scandinavia, Nordic, to include Finland.
Absolutely.
Yes.
Big loads of work up there. But what was actually fascinating to me at the time was the fact that, and I was hearing a lot of this secondhand from my colleagues who were wrestling with, but why is this? And it was a pretty obvious why. Things were turning up, were being paid for, were turning up in beautiful boxes, lovely machines, going to medical outposts and other centres. Nobody was opening the boxes. Nobody was using it.
But it's no surprise to me here. It's not just medicine that happens in tele stuff. There was a lot of telework activity in the 90s and the early, maybe as late as the early 2000s, where communities would receive this enormous thing that sits on a desk and could print and do all sorts of things. And in quite a lot of places, they just, as you've said, just sat in a corner or were put in a cupboard.
Yeah, absolutely. What a waste. And this is to do with social factors.
Yeah.
It wasn't to do with technology, and it wasn't to do with the need. There was, there might have been a need, although they perhaps didn't really understand the need and the connection between what this thing could offer and how it could fit their needs. There's also fear of the unknown, fear of giving up things that you think are important in order to learn how to use the new way of working. So these are themes again that have kind of cascaded throughout these years of working in digital health to do with this resistance to change. We've published on issues to do with barriers to implementation in different contexts of different types of health information technology and health settings, but also in terms of community settings. Similar things, again, in high and low income countries pop up again. So that was pretty interesting. And then after that, I moved to a lectureship at the University of Dundee in what was the Tayside Centre for Primary Care, it was called at the time, which later became called the Centre for Health Informatics. And a lot of the work there, I was taken on as a lecturer in psychology, but actually I was really a researcher in health informatics. So right from the get-go, I was doing studies on things like email consultations, which no one was really thinking about at the time, evaluating new integrated diabetes care records, for example, to see how different professionals would interpret and use these things. Looking at patient-centered tools for diabetes and other conditions like asthma, see whether they were actually, responding to them in the way we might expect. For example, text messages for young people with diabetes, for example, was another project. So I started getting more into this, and then it became my thing, really. And then I got this big grant and published this study on e-health and what is it. And that started off a lot of the e-health stuff. I wasn't the only one. There was another project as well. But it really, I think that was a massive amount of literature searching and packing together information and synthesizing. And then, so that was my journey into this field. And then after that, I moved to University of Edinburgh as a senior lecturer, again, senior lecturer in primary care this time. I'd been a lecturer in psychology, researcher in psychology, lecturer in psychology, actually in health technology assessment. And here I was now in primary care, which I guess is coming home because I'm a psychologist, although not that kind of psychologist. But actually, when I was there, what I was doing is setting up an e-health research group, an e-health interdisciplinary network, there was actually quite a lot of activity going on in the School of Computing. Some of the social scientists, a couple of the lawyers were getting interested in it, and of course in the medical school, but no one was gluing them together. So that really was where I got started there. And of course, subsequently, I moved forward with lots of different types of research and teaching programs and things in this field. And then it became my main area of research.
So you must be extremely busy with the pandemic. It's everything you're doing so topical. You must be in great demand.
Well, it's been a busy time, I have to say. I was, prior to the pandemic, I was doing research on participatory digital disease surveillance, for example, and had published a couple of papers with a colleague, Santosh Vijay Kumar, who was in Singapore at the time, now is in Northumbria. I'd set up a digital disease surveillance group at the University of Edinburgh with some vets and other people interested in, all the signal detection that was possible and how we could perhaps move this together, and was building up projects on syndromic surveillance, and I was teaching it in a public health informatics course. So I was really interested to see what's happening now. And of course, we've seen the latest participatory disease surveillance was what's been announced in the press just a couple of days ago, which is a government now offering everybody who goes for a COVID test to get their COVID genetically tested, so that they can at least see how the disease is spreading in the population and whether immunity is working. So that's an example. And the Zoe Symptom Checker, that's another example. It's an app that you download and you report your symptoms.
Yes,
and they get database.
I've been doing that since the beginning.
You've been doing that?
Yeah.
Okay. So that was very topical. Although strangely enough, I didn't do that much on that, apart from kind of tracking it during the pandemic. Mainly during the pandemic, I've been called upon to and have been working on to advise on, apart from the infodemic stuff that I mentioned, also the use of contact tracing apps. That was one of the initial things, and I published an article about that. I don't know if you saw that, but this was at the early stages when there was a massive kind of fight around whether this was an infringement of human rights, whether it was going to steal your privacy. Different countries were doing it in different ways, some very kind of nosy parkery, kind of snooping into everyone's lives and tracking them everywhere. And that sort of didn't go down well in the West at all. But at the same time, there were some really practical things we needed, and some of that debate had deflected us from some of the things that we needed to do. So there was a real need for to resolve this. But around that, there was a lot of fudge. It was a lot of fudge around uncertainty and lack of clarity about how these technologies were being developed, who was developing them, what features did they have, were there any secondary uses of the data that people were not being told about, where was the money going, was it the best use of the best app to be using, how were technology companies involved, and so forth, all of it, and is it the right privacy respecting protocol that's behind it? And of course, and then a lot of issues came together around that, and
all while it is extremely urgent to do something.
All the while, it's extremely
seemed to me, at least, to kind of increase the amount of heat in some of those arguments and discussions.
Absolutely, the context of need, high anxiety, fear, and also quite a lot of feelings of lack of transparency, I think, were coming along as well. But we there was something that could have worked quite early on, and one of the problems was that it didn't work early on. It didn't actually function properly early on, probably because it was new. Although they have been developing these things, the World Cup in Brazil, they had something similar, for example. So it wasn't rocket science. But there was a real chance we did need it. And perhaps if we had got it earlier on and started using it effectively, we wouldn't be in the position we are now. So now we're using a contact tracing technology when the disease is spread. And of course, now you're getting the press full of phrases like pingdemic. So now we finally got it working. Everyone was criticizing it for not working. Now it's finally working. And of course, the consequence of it working, particularly now that COVID has spread, it may be non-symptomatic in people who've been vaccinated, but it's spread. Of course, it's now pinging everybody. And we have to make a judgment call, a value call. Is that a good thing? Is it good that we know we're going to keep this thing under control? Or depending on, as often happens in health informatics, political ideology comes into play. Well, actually, this is hindering the travel industry, or this is hindering my business, or,
Yes.
and there are real differences of opinion, and you can see that in the newspapers that you read, whether they are left or right leaning.
The kind of, this is affecting our mental health in ways that are difficult to quantify or specify, which kind of elevates us. It's kind of a different it's an objection pretending to be different from it's interfering with our travel industry, but it's actually possibly very closely related.
Well, yes, absolutely. We don't want to be indoors forever because it does affect our mental health, and actually the more excluded you are from other things, and this is kind of where there's a link here, the more it will affect you, because you're probably already under a lot more strain, in terms of your life and the things you have to cope with. You may have less wherewithal to deal with it because perhaps you didn't get such a good education where you lived, or you feel disempowered because life has got you down, or you've been in the system. And of course, being stuck indoors might also stop you from being able to work and earn your income. And you may be in an abusive relationship. We don't know what people's lives are, but the point of the matter is there is this problem. For other people, it's not been so bad at all. They've had absolutely lovely lockdowns. They really enjoyed getting to know their families. They got to do their gardens. Their salaries were coming in anyway. And actually, it was a quite life-enhancing thing for them.
One claim that's been made all the way through, I don't know what you think of it, or whether it's really got any, or whether it's so general it's a meaningless question, but it's been said that societies which have fewer or less distinct inequalities at the beginning of the pandemic have reacted to and coped with it better than those who have more inequalities anyway. Do you think that's oversimplistic, or do you think there's truth in that, or how do you look at that sort of statement?
Well, I think it's probably true. I haven't seen the evidence, but I think it's probably true. Lateral societies are much more resilient, and there are
those with fewer inequalities.
Yes, absolutely. Fewer inequalities, and in the sense that we're all in it together. So we don't have certain politicians, members of their family, being able to sort of break the rules and go off to their holiday houses, because maybe everybody has a holiday house, like in places like Norway, everyone seems to have a cottage somewhere. But the point of the matter is that there's this a much more feeling of solidarity. Oh, you still there?
Yeah, we're
yes,
here.
Here.
Yeah, we can hear you.
Something happened to my Zoom screen there.
Something's always happening in Zoom. You just ignore it. Zoom is a fickle friend.
Yes. Fickle friend. So anyway, so I think that is very true. We have a lot more inequalities here, but of course, there's quite a lot that's been done about it. A lot of spending has been done on the furlough scheme and so on. So that's that's been a good thing. And actually, that has got another angle to it, which is digital, in the sense that those things have been digitally administered, and that's also potentially leading to other sorts of difficulties down the road: fraud, expenditure, unnecessary expenditure. We've actually also seen unnecessary expenditure on groups which are already well off. So big businesses, for example, profiting from tax breaks in the pandemic.
Eat out to help out.
Yes,
Eat out to help out with a classic
yeah.
example. Yeah, really, strategically mistaken from a public health point of view. But also, I don't know, one could speculate about who the beneficiaries are, but I know that's not the purpose of this talk. But I think the inequalities thing, it does feed through. The other thing I was doing have been working on is and advising on issues like vaccine passports, for example, which are also related to this. We were able to have some traction in Scotland with the contact tracing apps. We went for a privacy respecting solution. It's imperfect, but also acceptable. So, there's that trade-off. The vaccine passports, again, has been a real challenge. They're not out in Scotland yet, for example, because perhaps there's a lot more concern about getting it right, but also making sure it's private enough, making sure it's proportionate to the need. Actually, and is a paper one okay? And actually in Scotland, they prioritise paper. And again, wonderful for digital inclusion. My parents, they're elderly, and they phoned up and they got their paper passports almost straight away within a few days, and they were very, very happy. So there's no problem with that. The only problem comes when you go abroad, and of course that has now become digital is becoming a standard. Not yet a standard because, of course, all the different countries can't yet agree on a common protocol.
But it must be digital.
But it must be digital, exactly. So in my view, better off with paper to start with, and at least, it's a sort of a leveler paper. Everybody understands paper.
Lowest common denominator, isn't it?
Yeah, absolutely. The minimum viable, privacy viable product, if you like, I think is useful. And so, we're more encouraging them to do much more relative risk assessment of what are the pros and cons under these different circumstances. So that's and I'm doing a project with the Bingham Institute for Constitutional Law, which is around the role of technology, the role of good governance in the use of technology during pandemics as well. So we're actually just looking at some of that background information to do with, is it ethical? Is it legal? Who's made the decisions? Are we actually are we set up internationally in the UK to make good decisions in rapid time about these technologies and do so in a way that is consistent with the rule of law and involves and includes the public as part of that decision-making process.
Well, we always say nearly every week, so I'll say it now for this week, that digital inclusion has at least 3, probably 4 elements. Let's see if I can remember what they are. It's you need a device to be able to connect to get digital stuff. You need that device to have enough data and connectivity to do what you need to do, and you also need support. We all need support. It doesn't really stop the need for support just because you're more confident. We all need advice and support. But the fourth thing is that we need to keep each other safe online. And I think, in summary, what I'd say about everything that you said there is that it's good to hear a description of one strand of activity that's going on near to government in academic organizations, which aims to keep us all safe in various different ways. And I think that's been a really interesting insight into that world.
Thank you. It's true. I would sort of maybe add one more to the definition.
Go ahead. Yes,
of accessibility. in the sense that you may have the technology, and you may even have a broadband connection, but if you don't have the skills and, importantly, the empowerment to use that technology, then it just becomes a sort of scary kind of hyper expensive computer in the background. People go off and they buy the most sophisticated Mac, thinking that's going to make them a better computer user than if they just went for the most basic off-the-shelf Tesco job. And they would have, for the thing that they need, that's actually all they want.
So we've got so our third thing is not just skills, it's also empowerment.
The right kind of support at the right time. I mean, I've done some work on this, doing tech support for Aging Better in Birmingham, and people wanted the help when they wanted it, not kind of to wait. If they were kind of starting to explore the digital world, they wanted to be able to ask the questions they had while they were doing the exploration, so that they weren't kind of waiting around and getting bored and frustrated and forgetting what they'd learned. Because it's hard to learn. It can be hard to learn something, and then if you don't get to practice it and kind of ask questions, it's a waste of your time. So I think that's very important, and it's something I'm trying to bring into this digital literacy project that I'm starting to run now. We have devices that we can lend to people, laptops, because we know that older people's fingertips aren't so handy on the touch screen. We discovered that in our work, in our research. So we have laptops. We have a certain amount of tablets as well, but laptops is the main thing. And then kind of what I'm doing is compiling a list of courses and support that people can access, so that they can, when they want the help, they can get it, and as little or as much as they want. Some people just want somebody to say to them, this is how you switch it on, this is how you connect to the internet, and then away you go. And some people want you to sit by them while they discover each, open and close a laptop. The familiarity that we take for granted is not familiar to everybody. And so, again, it's the lowest common denominator in finding out what's most handy for people.
Lowest common denominator in a good way.
Yeah. Yeah.
It reminds me of Delia Smith wrote a book, very successful, How to Boil an Egg.
Yeah.
Yes.
Yes.
And if you already knew that, you could skip that bit and go to the useful part.
Yes, exactly. But you didn't feel bad about not having it.
No, exactly. That's what we don't want, not to make people feel bad. This is not about shaming people and sort of embarrassing them and saying, there's something wrong with you if you don't understand the digital world, because why would they? They didn't have resources, they haven't had the connectivity or the interest. And through the pandemic, they've had to, which again has its problems amongst others, which is, people are having to explore and discover and use digital on top of the fear of missing out or getting ill or worry about their family and friends, or they're losing their job.
And also, while it's
not
even
the
more,
best basis.
Also, while it's even more difficult to get face-to-face advice than normal.
Yeah. So we recognize all that, and we want to encourage people to come into the family of digital at their own pace.
I think that's a very good point. And I recently published a paper on the experience and learning from primary care during the pandemic, as in the Journal of Global Health. And
primary care being GPs and
primary care
district
being
nurses
GPs and district
dentists,
nurses,
anything that's not in a hospital, basically.
Stuff, yeah.
Exactly. Although I was focusing mainly on GPs and people that work connected with GP surgery, medical primary care, but I'm acknowledging that primary care is broader than that, but mainly thinking about GPs. And this question of digital inclusion is a big one here, because we saw a push towards normal GP care wasn't possible. In fact, you were being turned away. And actually, there was a number of issues that have come up, I think, which have really important messages or lessons about digital inclusion. First was actually not even the GPs to start with. There was anytime you phoned any kind of doctor or any kind of health service at the beginning of the pandemic, there were some rather off-putting messages that said things like, even NHS 24, NHS, which it is in Scotland, your telephone helpline, it would be, basically the message is, do not call us unless you're dying, okay? Because only dying people matter if you think you're critical and going to hospital. Otherwise, get the hell off this line. That was basically the message. And I know quite a few people that encountered that message, elderly people in excluded groups, people not necessarily empowered to work around that system. And one of them was my aunt, who delayed consulting for cancer, which ultimately killed her. Really tragic. It could have been caught earlier. And she's only one amongst very many, and this has been in the news a lot. And of course, my own mother had a fall and would have needed some support. But the first message they got is, "You're not dying." So I think there was rapid learning about how to alter those messages. Of course, NHS has suddenly, in fact, quite early on, everyone said, well, hang on a minute, we are actually leading to a symptom iceberg, if you like, or a consulting iceberg. So there's all these people with pent-up needs for care who are not getting them, and we're going to end up with much worse problems in the future. And that's what we've seen happening.
I suppose at the very beginning, it wasn't well, it might have been clear to some in the NHS, but it wouldn't have been clear even to all in the NHS that it wasn't just a fortnight shutdown and then we're all back to normal. And it would be possible that people who were in charge of recording those phone messages didn't quite get what the journey we were heading off on in terms of its sheer length. I don't think anybody would have said back in the first couple of weeks that we would still be having
no, you're right, and I know I don't blame them.
No, but it's a very important lesson to learn. Yeah. There's no doubt about it, and yes.
So, but anyway, I think that was kind of tackled. Learned a lot more about how to communicate. I think though, latterly, the move towards digital first services has been a real source of kind of unease in some quarters. In a sense, it's been, we've seen in a very positive sense things that we've known were possible back from the days I mentioned before when I was in Aberdeen, when we were sort of doing it to oil rig workers. That was, why was that not happening before? Why did GPs not do email consultations? Why did they not do video consultations? Why should that be a thing for young people who are digitally included? That is just normal life. So they find it very odd that that's there. So in a way, there was a catalyst to change that came along, and we saw actually GPs realizing that their previous fears, some of them were not well-founded, and patients, their previous fears were not well-founded. Actually, they found it okay. But there's also been quite unusual things that have happened in the sense that some policymakers and technologists and tech-savvy clinicians were very keen to push, this is working okay, so let's go digital first, digital by default. Matt Hancock saying, all consultations will be put through an artificial intelligence robot and so forth. And it seemed to be the brave new world. And now was the chance just to kind of ditch the old and welcome the new. Now, that didn't work out, and it didn't work out for several reasons. Firstly, because actually it's expensive and it's difficult to do. It doesn't always work. And secondly, people actually benefit from telephone consultations. So we've seen actually the most popular way of consulting in the pandemic has been with the telephone, a traditional technology. It's digital health because they're mostly digital lines these days, but it is absolutely adequate for most things.
Yeah. Slight tangent. All these thingy projects that were happening in the 90s and the 2000s, particularly in the Highlands and Islands because of distance, blah, blah, blah. We quickly had a filtering question. Why is the telephone not good enough for this?
Very good.
And a lot of the time, there's no good answer to that, and the telephone was fine.
We want something. We want to use the technology.
The answer was
we want to be
because we want
shiny,
to be flash and use something that's enormously expensive and very good for our projects office.
Yeah, absolutely. I mean, I'm not saying there haven't been some good experiences. There have been in national rollouts. There's one called Attend.
If you can answer the question, let's do it. Absolutely. Yes. If the telephone is not adequate, then let's get on with it. But
Well, it's funny actually. It reminds me of work that myself and many colleagues have done over the years in lower income countries, where the big kind of Western tech firms or charities with big budgets from places like United States would kind of roll in with their technology, which is going to solve the problem. And actually, they were finding things like smartphones. It was pointless having a fancy smartphone app because nobody had a blooming fancy smartphone or the airtime to use it. Yeah. What they had was SMS feature phones. You actually put the same messages into a text message, it can be just as effective. It's frugal, it's available, and everybody can use it. Even my...
I think to be fair, there's been a lot of learning in some environments about this over the past 20 years. But I don't know, why is it that this phenomenon just keeps on cropping up in every new thing that ever seems to happen? It seems to be infested with this sort of nonsense. Why do you think that is?
Well, I think it's what they call techno-optimism, isn't it? This idea that technology will fix things. And there are things that technology can fix that we can't do without technology in certain things. There are going to be certain circumstances in which these things are very useful. So, and there will be some studies and evidence to say that. But we have to watch out that we don't end up believing the hype. We end up with a lot we have hype cycles in innovation. There's even Gartner's even devoted, he's got his entire industry based on his hype cycle. And we see it for all sorts of
is that gamekeeper or poacher? Now let me think.
Well, quite,
Bit of
yes.
both.
Absolutely. Yeah. I mean, but anyway, we see hype and optimism. Some of that optimism is well placed. You know, if we didn't have tech enthusiasts, we wouldn't get anywhere.
Yeah.
We would still be old school. We need that. But we also have a lot of, I hate to say male, but sometimes you think of it kind of being quite a male phenomenon, that the technology, you know, men are from Mars, women are from Venus. Now, it's not the case, and I'm sorry, I don't want to sound like a sexist.
It's absolutely true. No, I completely agree with you.
Yeah, there's a certain amount of machismo involved in technology, has to be said. Yeah.
Yes,
for sure.
There is. So I think it probably has a lot to do with that. But I think, you know, in terms of the policy argument, it has a lot to do with the desire to save money.
Mm-hmm.
And some of that you might say, oh, that's not fair, you just want to cut me off. Some of it is, you know, it's a good idea to save money, because obviously we spend a lot of money, and the more money we have left over, the more good things we can do, and more we can reach people that actually need the money, actually need that intervention. And for me, that's probably one of the big messages that's come out of digital health in the last few years, and certainly we've seen in the pandemic.
I think there's another area I'm aware of that's just beginning with this kind of discussion, and that's the legal system in England and Wales. There's a big push there to make everything digital now that we can. I understand. I don't know much about it. I don't know if you've heard of this, because you're obviously specializing in health. But there's some people asking, you know, is this really fair? Who are we excluding by beginning to do it this way? Perhaps even more than some people are excluded from the legal system already.
This is what we talked about in a previous show, Sweyn, about where people are having online courts rather than face to face. Yeah.
Right.
I think you're right. In fact, there's a case study. I'm this national expert group in digital ethics. One of the case studies that's being worked up is around the Zoomification of the judicial system.
Wow.
And we have a lawyer working on that at the moment.
That sounds good. I'll wait for that one.
Well, the piece that we covered on a previous show was saying there was, you know, the inequalities, there was a danger of inequality if you couldn't be face to face with people and work things out in a court, that the nuances and so on. And also judges are maybe not the most digitally skilled people, so they might skip things or miss things, and that would be to the possible detriment of the accused. You know,
it's kind of like when you watch science fiction. Star Trek springs to mind, where there's just this automatic, universe-wide, instantaneous video communication that nobody ever misunderstands. That's been so embedded in entertainment and so on that I think that some people just fail to see, particularly some high-ranking expert people, call them machismo and male if you wish, fail to see the factors that can disadvantage people who now suddenly have to rely on this means of communication, compared to those who are privileged enough to be actually in the room with decision makers, judges, whoever.
Yes.
I think well, it's argued that one reason why there was a fad for sort of flip top mobile phones was because that's how Star Trek devices worked, and designers designed them that way.
Yes.
I'm not sure if that's actually strictly true or not. It's just kind of useful, maybe.
It does. It looks like a tricorder.
Yeah. If you think back to the
not a tricorder.
90s, not
a phaser, not
communicator
a
from the original series. Let's not go down the Star Trek.
Showing our age now.
But the thing is, I think everything you said just points out something which again has been something that we perhaps haven't said enough here. Every change has a social, a psychological, and some other context that has to be worked through in order for it not to unfairly advantage some people as opposed to others, or whatever.
I think Claudia's, got the ethical side of things as well, which is so important.
Yeah.
That we don't, we need to keep reminding people. It to me, it has in the past, not now, has sounded very tedious and sort of, oh God, do we really have to go through the ethics? But yes, we really do have to go through the ethics of it. And I'm so glad that people like Claudia are there, sort of calling us to account, reminding us what's really important.
That's right.
Well, this so-called digital health divide is really important, and I think we need to really keep an eye on it. We've talked about the digital divide. We've talked about the inverse care law. People who are most in need of healthcare are the least likely to receive it or have the be empowered enough to recognize their symptoms and ask for help.
Yeah.
Or maybe not have the circumstances. We see the same in digital, but I don't want to diss it all, because a lot of digital has great potential to support healthcare, to support people. If you can't get out of the house for some reason, not just because of COVID, because you maybe have a disability, technology may be a wonderful thing for you to be able to connect with the world and connect with your healthcare providers and your social care providers and your friendship groups and all sorts of things that
Events,
would not
everything.
have been possible.
Yes.
Yeah.
Everything, absolutely. And we see,
Go ahead.
I was just going to say, but even, if you look at young people, even those in fairly impoverished circumstances often have mobile phones. And those mobile phones, even the cheapos, are connected to some kind of internet. There are freebies that you can get. In some countries, they produce, it's not without controversy, but organizations like Facebook were offering something called free basic internet, provided you don't mind being tracked. So that raises another issue. But the point of the matter is that these are little windows into the world. And they can also help to, whilst technology is often criticized, and particularly in the context of digital health and other areas, things like artificial intelligence are often spoken about as being amenable to bias, and that bias can, digitizes inequalities, and that is absolutely so. As you datafy people, as you create algorithms that predict them and so on, you actually can set up the means to exclude them from services in the future, or you start to label them as being responsible for their own conditions and therefore less worthy. There are all sorts of things there. On the other hand, they can also help to eliminate bias in certain ways. Look at your courtroom, for example, courtrooms are full of lots of posturing and grandstanding and clever dickery by opposing counsel. Okay. And sometimes, very, very often, if you ask anyone in the police, well-built cases fall apart, let's say for domestic abuse or other things, because someone has been so clever in their behavior in court. Now, what happens if it's Zoomified, for example, if it's actually very much focused on the giving of the evidence? You may be eliminating some of that extraneous noise and allowing people to focus.
Absolutely.
The same thing's been true in the context of work. For example, I do actually also a lot of work on workforce informatics and some of the ethical issues associated with that too. And again, those issues come up to do with labeling and bias systems, which will prevent you from getting a job because the AI has been programmed based on men's CVs and women's weren't getting the jobs. So Amazon had a hiring algorithm like that. But at the same time, we've seen in other firms being able to use the data on people's actual performance in a way that is blind to their gender can lead to promotions for women that wouldn't have been possible otherwise, because they were being judged in a social context of being servants to men and not the other way around. So we have potential here. The trouble is we just need the right people on the case to make sure we can get that sweet spot.
Absolutely. So Claudia, where do you, we're going to be running out of time shortly, but where do you see if you're advising communities, what do you think communities should be investing their time in going forward, especially around digital health?
I think education is critical. We have run quite a lot of public panels actually in Scotland recently. We call them mini publics, and as a deliberative engagement over time. And we're doing something similar on a shorter scale with the Ada Lovelace Institute recently around some of these themes as well. And there are a number of themes that come up, but there's this feeling of certainly in the Scottish sample, having the skills and the knowledge to make good decisions about information, to use it effectively to get what you want, but also to avoid the kind of online harms that can come about, and error as well. So the ability to identify misinformation, for example, the ability to find sources of support when you need them, so that's that's one way in which policymakers can actually influence. They can influence the educational system. They can spend on public awareness campaigns and so on. And things like the NHS Digital Inclusion Guide, which was developed a few years ago, it was a very good way, gave a number of ways of improving this. And so I think that's important. I mean, of course, secondly, there's things like cheaper broadband and phone services and so forth, and ensuring that those are available to the communities that need them. There was quite a lot of spending, for example, on laptops for school children during lockdown in deprived areas. But that does need things like contracts. And again, there are fairness issues to do with so-and-so getting it for free and so-and-so paying. You don't want to also create social disharmony when you get that sense of unfairness on a postcode lottery type level of discussion. So actually getting that right is not as easy as simply giving out free broadband, although I think most people think of it as a natural resource now, a basic utility, like the water and electricity or internet should be free, and even telephone calls are extremely cheap. But they are bringing other problems with them, and I suppose that will have knock-on effects for inequalities in the future. And one of them we've also been looking at is the environmental impact of using digital technologies, some of which are very intensive in terms of their use of electricity and their carbon production.
I think also this is one of my interests as well, the environmental cost of technology. I think it's very important.
Sharing the digital inclusion
so
guide
that's
for
what it looks
social
like.
care. Yeah, it sounded fascinating.
It's important to compare the environmental cost of technology with what people would otherwise do. So although you can say all the statistics about how much electricity all the data centers in the world are using, you've got to compare that to what else people would be doing if they weren't using the electronics.
Yeah, that's true. We would all be flying.
Exactly, or driving to the doctor's surgery or whatever.
That's true.
So there's a trap there's traps everywhere, obviously, about everything.
Yeah.
But one of the traps that I'm very interested in is this focusing on the technological environmental cost without comparing it necessarily with what the alternatives would be to have the same sort of activity. We should always be reducing demand for stuff and for energy wherever we can, but we need to make sure that we use it in ways which make a big difference positively, rather than focusing on some of the statistics that are sometimes focused on.
Yeah,
sorry, that's
you're
a bit of a rant
absolutely
of
right.
mine.
No, you're right. And there's the United Nations chair of ICT for development has set up a working group that I'm part of, which is looking at some of these issues. And you're absolutely right. It does need to be balanced. Some things we're going to be, the benefits outweigh the harms, and other things perhaps are things that maybe we're doing that are unnecessary.
Absolutely.
That could find other forms. I think just one thing I'd like to touch on finally in terms of inequalities, although we've talked about a number, in terms of telemedicine and so on, there's issues that are raised to do with things like whether you're losing empathy in the conversations and so on. I think that's very important. And whether you're failing to detect things that you might have detected face to face, but that's not so much to do with inequality. There are questions to do with inequality in terms of the provision of services. I've mentioned before, when we move towards a world where artificial intelligence, robots are going to be making those decisions based on data, and may lead to you not getting a ventilator, whereas somebody else got a ventilator because their stats say that they were a better candidate, they're more likely to have a better outcome. And maybe economically that seems fair, but sort of psychologically and socially, it doesn't seem fair at the time. And finally, I think we have to acknowledge what I've been calling the digital privacy divide, in the sense that the least empowered people are also the most likely to be datafied, for example. They may be more likely to be engaged with lots of services that share information about them and make decisions about whether they're on benefits or whether they're going to get a house or so on. So they're already in under the spotlight in a way that's unequal. But they might also be less empowered for the other reasons we've mentioned to take the steps that are necessary to safeguard their own privacy and their own, well-being. For example, stopping their health data being mined by an advertising company that then sells them some snake oil. This is really important, I think.
Absolutely. Claudia, sorry, that's been extremely fascinating, really. I think we could, like with most of our guests, talk and talk. But I hope our listeners will have picked up some really useful information from there. If people want to follow up with you, Claudia, where's the best place to find you online?
You can find me on Twitter, which is @Earn, which is big E, small e, big H, big R, big N, or just type in my name, Claudia Pagliari. And it's a strange acronym because I set it up as Edinburgh eHealth Research Network, and now it's just become me, and I don't know how to change the name. So, and I'm now Earn, not Ernie. I can call myself
Ernie. No premium bonds here.
So that's a good way to get me. Or you could email me on claudia.pagliari@ed.ac.uk or reach me on LinkedIn.
Great. Well, I think we'll be coming back to you, Claudia, at some stage. I certainly will in my work. I think people have found it very interesting. And what's useful is, although you're an academic, you haven't, you obviously mix with a lot of people for whom academia might be not, a different world. And so you have contact with the people, which is very important to us. So thank you very much for that. Sweyn, can we cover one of the stories you picked up before we close today? The one on COVID made us more digital, but at what cost? This is from the nakedscientist.com. I thought would be useful to bring up to people. And this is an article that appeared in, was it July? What's the date on the screen now? June of this year. And it's about exacerbating the digital divide. And I like this one because it talks about digital health and good digital hygiene, if you like. So it says, in the context of the epic risky nature of living our lives digitally, one of the European Commission's 6 strategic priorities for 2019-24 was to create a Europe fit for the digital age. So technology works for people. The digital economy will be fair, and it supports an open, democratic, and sustainable society. And one survey conducted in July 2020 found that more than 1 in 3 workers in the EU were then working exclusively from home, relying almost exclusively on digital tools to socialize, work, and access any state service they needed. So researchers are now asking whether our reliance on digital tools leaves us on the wisest path. And Dr. Matthew Dennis at the Technical University of Delft in the Netherlands is an ethicist interested in applying the philosophy of human flourishing to the digital age. And he looked at 3 frameworks for enhancing our digital well-being in pandemic conditions. And first were rule-based frameworks, such as that issued by US-based nonprofit, the Center for Humane Technology. And these suggest people take specific steps, such as limiting their time on devices and taking care to do exercise designed to promote mindfulness, which I'm doing, which I must say is very helpful. Second were character-based strategies, which say we ought to cultivate character traits that will be useful in the online sphere, such as the ability to control where we give our attention. Again, one that I struggle with sometimes, but I'm getting better at it. And the third way is not so much something for individuals, but for designers. And this is to explicitly change the way the online spaces are designed so that they don't prompt us to make choices that are bad for our well-being. And I think this has something to do with, the way some online programs have different colors to make you try and do more of what they want you to do, rather than the thing that might be better for you. So I think that was a useful article to look at, and one that we recommend to our listeners. But that does bring us to the end of the show for this week. So we hope that everybody found it useful and interesting, and that you continue to stay well, stay safe, and have a great week. So have a great week, everybody. Bye.